Hey, do you know that you're in my spot? Do you know that you're gonna have to move so I can film something? Okay. Hey America! So in other news, the Trump team released a new report to the whitehouse.gov website, and it is full of love, support, and thoroughly investigated facts. And yeah, I'm lying. It is just filled with more anti-trans discrimination. But this time with a focus on transgender kids. So I'm sure this will be exciting. Are you feeling tired yet? Like, you can be honest, you're not alone. So many people around the country are currently feeling exhausted, and we are only just now hitting the first 100 days of this current administration. Remember, that feeling of drain is by design. Stay strong, find community, and remember that you are loved. Also, do you know what really frustrates people who seek to put others down? You guessed it. That is keeping the joy alive despite all that they do. And to help spread some of the love, Trans Unity Coalition is looking to keep that joy afloat. Our team will be giving away gift packages to 3 lucky viewers. Interested in details? Stay tuned to the end to find out more. For this report, we wanted to break down what it contains with some interjections and intermittent explanations. Because as we all know, reading something where line after line is attack after attack is incredibly demoralizing. So we hope this video provides the same breadth of information with some built-in emotional buffers. Released earlier yesterday, April 28th, report to the president on protecting children from surgical and chemical mutilation. Executive summary. Oh, and you wouldn't believe how many times this one word gets used, so we included a counter to keep up. Oh, and I think a lot of us take some issue with the bias in this title's name, so we will be referring to it with a more appropriate title. Report to the sexual abuser-in-chief on denying our nation's transgender minors appropriate gender-affirming medicine executive summary, or the Don't MAGA Me summary. Even better that it didn't tick the counter. The Don't MAGA Me summary, released yesterday, April 28th. Background. Under President Biden, the federal government promoted a grotesque social and scientific experiment on American children. This part should say utilize established and evidence-based medicine. During the first 3 years of his administration alone, more than 7,000 children were administered puberty blockers and cross-sex hormones. Over 4,000 were subjected to sex trait modification surgical interventions, such as mastectomies. These interventions were marketed to children on the basis of ideologically driven and financially motivated junk science. If we can call treatment like this junk science, can we call administration like this junk policy? On January 28, 2025, President Trump signed Executive Order 14187, protecting children from chemical and surgical mutilation. Executive Order 14187 prohibits federal departments from funding, sponsoring, assisting, or facilitating chemical and surgical mutilation of minors, and directs them to stop these immoral, unjust, and disproven practices more broadly to the greatest extent possible. So the word disproven, with the majority of clinical research in favor of gender-affirming care, the team seems to be hinging upon the limited bad faith articles, such as the CAST review, as well as more neutral pieces that caution more data in general is always needed, as grounds to claim that this is all disproven. The following sections summarize initial steps taken to implement this order. Restoring scientific integrity. Section 3, subsection 1 directs agencies to rescind or amend all policies that rely on the Standards of Care version 8, developed by the World Professional Association for Transgender Health, also known as WPATH. These standards were not drafted based on scientific evidence, but on political considerations. So this is an outright lie. The Standards of Care 8 literally has 69 pages. Yes, haha, you can't make this stuff up. 69 pages of scientific references. How many pages do you think the Trump team's paper will have? I'm expecting a small turnout. During the drafting process, then Assistant Secretary for Health, Admiral Levine, who this team will ignore, is both a licensed pediatrician and an openly transgender woman. You can also thank her for her work in helping to allow law enforcement officers in Pennsylvania to carry naloxone, and for her many years of LGBTQ+ advocacy. Then Assistant Secretary for Health, Admiral Levine, lobbied WPATH to drop its proposed age limits for surgical mutilation. Levine then issued federal guidance titled Gender Affirming Care and Young People, which promoted the chemical sterilization and surgical mutilation of minors. After President Trump took office in January, the Department of Health and Human Services, HHS, immediately removed this document, along with other pseudoscientific information, from its web pages. pseudo not being an appropriate prefix. It's even worth mentioning that even beyond gender-affirming clinical data, Trump has effectively ostracized America's scientific community with funding cuts, executive orders, Trump's COVID response during his first term, and just in every way that he is pushing an anti-intellectual takeover in America. On February 14th, a court order compelled HHS to display this document and other pseudoscientific web pages. HHS followed the court order, but provided a notice that it disavows Levine's document and all materials that cite WPATH in the strongest possible terms. Said notice can be seen on each page that was court-ordered to be put back online. Also a plugin that, since our team is working on browser extensions to remove this disclaimer from each page, please reach out if you have any interest in helping us there. Section 3, subsection 2 directs HHS to publish an evidence-based review of the literature on best practices to promote the health of children who assert gender dysphoria. Experience gender dysphoria is way more appropriate, since they are, trying to frame this as a kid throwing a tantrum and asserting something. I think they might be confusing this with Twitter and Trump making shit up all the time. Sorry, I shouldn't dead name X. HHS has coordinated with a team of 8 distinguished scholars and will publish this review by the 90-day deadline. So I'm curious about these 8 distinguished scholars, but it will be absolutely imperative to look into their publication history and also where their funding is coming from, both past and future. But in another example of pushing away the scientific community, how many distinguished scholars in those 69 pages of the SOC 8 references is this administration just dismissing? Years of research, acquiring funding, proofing, and still no shout out beyond calling what they made junk science. Promoting accurate information. Section 3B directs HHS to use all available methods to increase data quality to improve practices for improving the health of minors with gender dysphoria. The lead researcher of one notable study, funded by the National Institute for Health, NIH, withheld its results from the public for political reasons. Fact check. This is false. And for a full breakdown of the story, which has already been covered, Aaron Reed from Aaron in the Morning published a wonderful expose covering the bullying of this researcher back in October. Please check that out. But to say the results were withheld when the original researcher has been on record to say that due diligence is required to not rush results, this should be something that any researcher strives for. In fact, that's literally what makes real science stand out from junk science. The NIH has taken and will continue to take all necessary and proper steps to ensure accountability and transparency for all taxpayer-funded studies. HHS is reviewing data tools to ensure the federal data collection reflects biological reality. Biological reality. I have heard this term before. This is an unoriginal adaptation of Trump's executive order defending women from gender ideology extremism and restoring biological truth to the federal government. Now, in principle, I love biological truth, although I typically just call that the field of biology, biological reality, and provides medically useful information, which if true, I would expect to see the normalization of transgender experience and affirming treatment. But if we really mean the full breadth of biology, then something positive to include the full diversity of our genetic range also includes intersex people. You know, so we don't get stuff like Texas Representative Andy Hopper saying stuff like this.
Where do intersex people fall into that equation?
Yeah, those intersex individuals are still XX or XY, so you can't change that.
Come on, Texas. Stopping taxpayer-funded child experimentation and mutilation. Section 4 directs HHS to immediately take appropriate steps to ensure that medical institutions receiving federal research or education grants end the chemical and surgical mutilation of children. HHS has eliminated 215 such grants, saving taxpayers over $477 million. 2 examples include a $1,319,024 grant to the Center for Innovative Public Health Research for #Transcendent Health, adapting an LGBT+ inclusive teen pregnancy prevention program for transgender boys, and a $5,955,310 grant to Boston Children's Hospital for Trans Health Guide, transforming health for gender diverse young adults using intervention to drive equity. Okay. So this one's interesting, and this one actually is going to run a little bit longer. I really wanted to find out more, so I looked into these numbers. The Center for Innovative Public Health Research, $1.3 million grant. It was actually 2 award years, with 2024 only being $620,000, which I will refer to as Grant 1. Boston Children's Hospital's $5.9 million grant is actually 3 award years combined, with the most recent in 2024 being $1.3 million, which I will call Grant 2. Furthermore, the budget start date for Grant 1 was September 6, 2024. So many of these funds would have already been drawn down between start and termination. Likewise, Grant 2's budget start date was July 1st of 2024, meaning a majority of these funds would have already been drawn down. So realistically, I'm going to bet that this claim of saving $7.2 million between these 2 sets of grants is actually closer to $3 million. So that's a little inflated. However, I actually still have more to add. The average NIH extramural grant awarded in 2023 was $609,000, up from $592,000 in 2022, according to a 2024 article released on NIH Extramural Nexus. An article which I had to pull up on archive.org because the original link has been expunged from the government's website. So these 2024 grants of $1.3 million and $620,000 seem like more or less typical award values for the 2024 year, with a more elevated one going towards Boston Children's Hospital, a major metropolitan research hospital under Harvard. The Trump team is saying they eliminated 215 grants, and while I don't have the exact value, let's say the average 2024 grant was $620,000, slightly up from the 2023 based on the 2022's value. 215 times 620,000. This gets us about $133 million, already significantly down from the claim of $477 million. But these awards are on a grant cycle, so some of these grants would have already been almost finished, and some of them would have been just beginning. So to guesstimate, let's take about half. So $66.5 million, or about 14% of the original savings claim. Granted, this is thinking backwards for pre-existing issued grants and not inclusive of thinking forwards for potential future funding, but the primary concern still stands. This team is clearly manipulating the numbers and outright lying about how much they're saying is being saved from pre-existing grants. They are trying to sell the idea that these funding cuts are saving the American taxpayer more than they actually are. But you know what else is flawed in this calculation? Studies that help to expand understanding in ways that seek to prevent children from taking their own lives is actually a long-term investment. That kid could have been an engineer, or a counselor, or a soldier, or literally anything else productive to our country. And if you aren't interested in doing the right thing by looking after our marginalized youth as a matter of principle, then run the fucking numbers of the cost as a loss to our society. Anyway, oh, right, I was reading this bullshit excuse of a public statement. Ensuring proper medical treatment. Section 5 directs HHS to take all appropriate actions to end the chemical and surgical mutilation of children. On March 5th, Centers for Medicare and Medicaid Services, CMS, issued a quality and safety special alert memo entitled Protecting Children from Chemical and Surgical Mutilation, which alerted providers to the dangers of chemical mutilation, as well as the lack of medical evidence supporting their use. It's worth noting that the CMS has a team handpicked by the Trump administration. And we expect to see, of course, policy, announcement, and other special alert memos that are clearly political extensions of that same hate. It honestly waters down the meaning of being a special alert memo. Among other provisions, the letter stated that it is of utmost importance that all providers follow the highest standards of care and adhere closely to the foundational principles of medicine, especially as it comes to America's children. This CMS alert to providers on the dangerous chemical and surgical mutilation of children, including interventions that cause sterilization, is informed by the growing body of evidence and protective policies across the world. Don't forget that cherry-picking studies which merely say more data is needed, and using that to say trans people bad, we're alluding to the many millions of dollars used in bad faith to foster prejudice in the name of growing body of evidence, while also actively suppressing research that legitimately seeks to accurately portray the data. This is neither sufficient proof of something, nor is it conscionable. Within days, similar letters were sent by the Substance Abuse and Mental Health Services Administration, the Health Resources and Services Administration, and the Office of the Assistant Secretary for Health. So these letters were all sent by agencies managed under the HHS, which is led by Trump appointee and personified scowl Robert F. Kennedy Jr. This administration is preparing other actions in accordance with Section 5. HHS, through CMS, is exploring every avenue to increase access to detransition care, i.e. making it harder for people to have necessary access to transitional treatment, while at the same time making it easier for people to detransition, and to later claim an increased rate of detransition as proof that they were right all along. Pursuant to Section 6, the Department of Defense has issued its health services contractors to discontinue child mutilation as a covered benefit. Pursuant to Section 7, the Office of Personnel Management has excluded coverage for the mutilation of the children of the federal civilian workforce beginning in plan year 2026, which, not surprisingly, the current administration is seeking to cut funding for all forms of gender-affirming care. But, as mentioned a moment ago, increasing funding for detransitional care. And, as everybody can clearly tell, increased funding for anti-trans propaganda. Ensuring equal protection and rule of law. Pursuant to Section 8, the Department of Justice, DOJ, has prepared guidance regarding enforcement of Title 18 of U.S. Code Section 116, prioritizing protection against female genital mutilation, and will convene state attorneys general to coordinate enforcement. So it is important to note their mention of prosecuting cases of female genital mutilation, but they specifically leave out its complement, male genital mutilation, because it would invoke something else that has actually been an ongoing advocacy issue for many years: circumcision. It seems the Trump team isn't confident enough to implement this yet into their hate strategy, which to me is a sign of weakness, that they know risking the wrong kind of public pushback would expose the ridiculousness of all this to a broader mainstream audience. It has also initiated investigations of multiple entities that have misled the public about the long-term side effects of chemical and surgical mutilation under the Food, Drug, and Cosmetic Act. Investigations which will enact a chilling effect on medical treatment, waste taxpayer money, and to rile up the MAGA base to personally dox and attacks healthcare providers, as they occasionally like to do. DOJ has drafted and submitted legislation providing a private right of action with a long statute of limitations for children whose bodies have been chemically and surgically damaged and their parents for additional review, which will likely allow for rare cases of those who do detransition who want to capitalize from it to sue their healthcare providers, simply because the option is there and there is something to gain. And look, I'm not saying detransitioning isn't valid. While it is incredibly rare, it can be an important aspect to self-discovery. Though the unfortunate truth is that it is almost always because of bullying, harassment, and social exclusion. But in any case, it is valid. However, what isn't valid is when people like Sinead Watson, Abel Garcia, or Chloe Cole take advantage of this experience to force the rest of their community down while making $1 off of it. DOJ will establish a parental rights task force to vindicate the rights of parents in states like California, where parental refusal to consent to the mutilation of their children can enable the state to remove children from parental custody, and to further uphold parents' recognized constitutional rights. In other words, for separated parents with political differences, a transphobic parent could have legal right to remove custody from a supportive and loving parent simply due to the rare occurrence if their children happen to have a gender-affirming surgical treatment. Ooh, that is quite a bit. So all in all, the Don't to MAGA Me report is awful. It should be noted that this isn't an executive order or policy. It's more like an arrogant bigotry brag for the first 100 days of Trump's office and all the implementations therein. It discusses cuts to research funding, paints a clear bias by framing medically necessary care as scary or harmful practices, and centers gender-affirming care around the political disagreement of the treatment and care itself, while detaching it from the needs and real experiences of the kids themselves. It should go without saying, but apparently must go with saying, that yes, children can be transgender. And I would know that was me and so many others. Kids can be transgender too. And to any kid out there who knows that feeling, who was born at a time when our country wants to make this the issue of the day, instead of so many real other American problems. And with these twisted, corrupt adults trying to take your life and your identity away from you in real time, you will absolutely outlive them and their hate. And it feels like forever away, but there are people out there fighting day in and day out for you and your rights. Please do not lose the hope that you can make it in this world. Grow and be you. That's the one thing these creeps can never take from you. And hey, if you don't believe me, I got you. Remember our giveaway? Trans Unity Coalition is looking to award gift packages to 3 lucky viewers. And here's what you gotta do. 1, subscribe. That's easy. 2, repost this video on social media and take a screenshot. It's okay, you can blur out your username or your image. It's totally fine. 3, we ask that you leave a heartfelt comment below. Someone out there is going to watch this video. Someone scared, alone, and feeling at their end. Talk to that person. Tell them what you wish you heard long ago. There's a real impact to sharing your stories, and sometimes that impact is helping to save a life. Screenshot that comment as well, and look in the description for an email to send those 2 images to us. We will select 3 random and unaffiliated commenters and send them some swag. On March 1st, we organized nearly 1,000 people in Washington, D.C. to rally for trans rights at the U.S. Capitol and the White House. And I am here to announce that on June 15th, our team will be heading back for Pride Month on the 5th anniversary of the Bostock ruling. If you have any interest in showing up to tell our administration that you will not be silenced and you will not be erased, follow us for more information on that to come. And in closing, when the administration says protecting women and children, they don't actually mean real people. They mean protecting the concept of their evangelically rooted ideals of womanhood, lacking bodily autonomy, the right to vote, the right to equal pay, and the concept of children as political brownie points to claim protecting, while also actively denying benefits to, depriving quality education from, and simultaneously praising them as our nation's future, while brainwashing them with outdated ideas such as crawling out of a utopian garden, or that kids somehow can't be queer, but can absolutely be straight and cisgender. We do expect to see so much more junk policy from this administration. At the start of this video, I asked if you were feeling tired yet, because with so much going on day in and day out, it is all too easy to become exhausted. But currently we are already 7% of the way through, and when it's all said and done, we will see you on the other side. Thank you.